Hi, my name is Hans Palma, and I work as a business analyst for the Alliance for Health. We, along with the Healthcare Employers Council, have begun work on a new program called the Labor Planning and Forecasting Project. We've put together this slideshow so that you can be made aware of our work. In general, the Healthcare Employers Council and the Alliance for Health focus on improving healthcare across the West Michigan region. This project is aimed at exactly that. Let's start off with a little background information. When you analyze the healthcare field, you'll notice that it's in the service industry, and service industries generally rely heavily upon human capital or human talent. This is especially true in healthcare. So if we want to improve healthcare, we need to look at ways to make sure that we have the right people at the right place at the right time within the healthcare industry. To begin doing that, we need to look at the talent supply chain. In very simple terms, the healthcare talent supply chain of West Michigan can be seen as a series of a few small pieces. First, there's the community talent, which feeds into our local educational institutions, who put out qualified workers into the labor pool. From this pool, employers draw in order to meet the community patient needs. Now that we have an idea of what the talent supply chain looks like, let's ask the question of what we need to do to go about managing and improving it so that we can have even better healthcare. To answer this question, we'll want to take a look at waste within the talent supply chain. One category of waste is production. We ask the question, are we producing too few or too many workers for a specific occupation? Another waste category is process. Are students getting over-processed? This means, are they being taught things that they will never use practically or things that have become irrelevant? Or are students getting under-processed? Are they not being taught enough of what they need to know in order to thrive in the healthcare field? Thirdly, we want to make sure that our supply of workers is being put out just at the right time so that we have neither a flood of the market or severe market shortages. In addition to addressing waste, we'll want to look at the talent supply chain for new opportunities. These opportunities may include revenue-making opportunities, such as opening up new training programs for growing occupations because no regional training program exists. Other opportunities may fall under the guise of preventative maintenance. Here we would be interested in knowing ways that we could recognize shortcomings in the talent supply chain early and take measures to shore up weaknesses in the chain. Now, a reasonable question at this point would be to ask if this focus is even necessary. Do we really need to manage the healthcare talent supply chain in West Michigan? For that, let's go to the news. Bridge Magazine recently published an article that compared the number of graduates of various fields of study from Michigan universities and private colleges with the number of projected job openings for those fields within the Michigan job market. Their analysis suggests that there were 14% more jobs available in 2010 than there were graduates to fill those openings. Beyond Michigan, there are some even more startling national trends. According to the U.S. Census Bureau, the share of the population aged 65 and older will increase dramatically from 13 to 19% by 2030. During this time, many healthcare workers will retire, creating large staffing gaps. Additionally, the aging population will require more workers to care for them. This is compounded by the rising trend of people opting for in-home care rather than taking advantage of long-term care facilities, which require fewer workers to staff. This national trend exacerbates the need for direct healthcare workers. This would not be a problem if there was no concern of labor shortages. However, several studies have concluded that the United States will see an unprecedented nursing shortage in the coming years. One such study suggested that the numbers will be as high as 1 million nurses. Another study suggests that there will be a 250,000 nurse shortage. Either way, the evidence points to an impending labor crisis. But nursing is not the only occupation in danger. Other direct care workers such as home health aides and personal care assistants will also be needed to care for the aging population. Current projections suggest that the number of workers in these other direct care occupations will remain flat if we continue to draw from the same demographic. In short, the need will rise, but the supply won't. If this weren't enough, the new healthcare legislation will play a significant role in the healthcare worker crisis. As healthcare facilities transition from the pay-for-reporting model to the pay-for-performance model, they will be assessed on several categories, many of which are directly impacted by the staff-to-patient ratio. Responsiveness of staff, nurse communication, and communication about medications are just a few of the metrics that the healthcare facilities will be measured against. When shortages occur in staffing, organizations will find their ratings plummeting. This matters because these organizations will be reimbursed by the government based on these metrics. If a facility begins to fail, it will receive fewer dollars for the services rendered. Without reimbursement, facilities will have to cut budgets, impacting their quality of care and pushing our healthcare system into a downward spiral. After looking at the reports and seeing the trends, we at the Alliance for Health and the Healthcare Employers Council have agreed that West Michigan needs a way to ensure that we have the right healthcare workers at the right place at the right time. We need mechanisms that will allow us to manage the healthcare talent supply chain so that we can forecast and respond to trends, eliminate waste, and seize the opportunities available. Which is why the Healthcare Employers Council has begun the Labor Planning and Forecasting Project. This project is an effort to manage the West Michigan healthcare talent supply chain by 1. Forecasting the demand for the few occupations that make up 80% of the workforce, and 2. Developing and executing strategies to meet those demands.